At Dr. Bral's office, we do our utmost to make dental extractions as comfortable as possible. Dr. Bral employs various techniques, some unique and some well known, to avoid cutting the gum for an extraction. He believes that by doing so, he minimizes the discomfort the patient feels not only during the extraction, but in the aftermath, in the healing process as well. In this 11-minute expert interview, Dr. Bral discusses his concerns and what he does to bring his patients back to their normal routines as soon as possible. Stay tuned for first-hand experiences from his patients after a dental extraction.
Hello and welcome to another episode of Local Expert Interviews. My name's Michael Grady, and I'd like to welcome Dr. Bral of Jersey City, New Jersey. Dr. Bral believes healthy smiles and confident well-being go hand in hand. Maintaining a beautiful smile is more than just regular brushing, but requires periodic professional care to keep a beautiful smile. Welcome, Dr. Bral.
Thank you. Glad to be here.
Dr. Bral, please tell us, our viewers, a little bit about yourself and your practice in New Jersey.
Hi. Okay. I've been in Jersey City practicing as a general dentist in Jersey City for close to 17 years. We've been doing all phases of dentistry under one roof.
I see. In this interview, we're going to talk about tooth extractions. So, what I understand is that many people dread having their gums cut to have a tooth removed. Can you tell our viewers a little bit about the complications that come with having a tooth removed in this way?
Well, it is commonly done. There is the surgical term for cutting the gum is raising a flap, and there's a common belief in the surgical community that raising a large flap, that is cutting the gum a longer span, heals at the same time than raising a short flap, that basically a smaller cut on the gum. So therefore, it's okay to raise raise a larger flap to cut the gum longer, so that you can have good access to the underlying tissues. And this is true, in fact, that basically the gum heals at the same time. There is no problem. But the one concern that I have is that the amount of discomfort with a larger flap is more than discomfort associated with a shorter flap. The longer the incision, the longer the cut, of course, it would be more uncomfortable. The discomfort and sometimes the associated problems with discomfort are the main issues. Aside from the psychological factor that the person imagines, oh, my gum is going to be cut. So these are the complications associated with raising a flap.
I understand that, of course, pain is probably the biggest cause for someone to worry about this particular type of procedure. I wonder, is there any kind of remedy that you know of that would make it a little easier for someone who is going to have a tooth removed?
Actually, yeah, that's yes. That there are some techniques. Actually, over the years that I've been practicing as a general dentist, I've developed techniques that do not require cutting the gum, raising a flap. We don't usually, if any, we seldom raise a flap for removing a tooth. And I find that our patients are more comfortable after the extraction. Now, please remember that even if there is conscious sedation or general anesthesia during the extraction, the person has to still cope with the healing process and the discomfort during the healing process, which might be a few days. By not cutting the gum, I believe that the healing process is more comfortable to the patient. Another technique that we use is that normally there is a push and pull associated with extracting a tooth, pulling a tooth really, that is not comfortable during the extraction. Now we have developed a technique. I'm using a technique that actually eliminates, or to a good extent, this push, this pressure that the patient would feel otherwise. So basically, he would be more, she or he would be a lot more comfortable during the extraction. Actually, it is something that I aspire to, because when I tell the patient, well, we're done, the extraction, I pulled the tooth already, you know, they were just waiting for a push and pull to come that never did. And I like the surprise look that they have, and they have to look at, sometimes they reach out and look on the tray to see the tooth there and say, oh yeah, the tooth is out. That's something that I aspire to, because I like to help people be more comfortable, and it's a good feeling that I can provide this service to my patients.
Oh, I see. And for the best possible outcome, if someone actually has to have a tooth extracted, can you kind of give us some of your advice on what people should do before and after a tooth extraction for the best comfort?
Yeah, sure. Before the extraction, I sometimes, for the anxious patient, I give them some medicine for the night before, so that they can have a good sleep, good rest, so that they don't have to, they're not so anxious about the next day that the extraction is coming. Also very important for anybody that wants to pull a tooth, to discuss with their dentist any medicine that they take, if they are taking especially aspirin or any blood thinners, and many of the heart medicine that they might be taking. They should discuss that. As also there are newer medicines that women take for osteoporosis. These medicines should be discussed with their dentist or oral surgeon before the extraction, so that special precautions sometimes need to be taken, and they are taken and they are prepared for the extraction. After the extraction, I advise the patients not to smoke, not to spit, not to sip from a straw if they want to drink, and eat softer and cold food for a day, until the healing starts, and there is the risk of bleeding is eliminated to a good extent.
I see. Well, let me ask you then. Let's say that someone knew they needed to have a tooth extracted, and they went through the procedures before. My question is it okay for someone to go to work after they've had a tooth extracted? What's the healing time before they can actually go back to work?
Very good question. It depends on how much trauma they had during the extraction. That's usually the case. Basically, if there is a lot of trauma during the extraction, then they might need more of a rest time before they go to work. In our office, since we don't raise a flap, we don't cut the gum, there is less trauma to the tissue, so that would help for the patient to go to work the next day. And majority of cases in our office, patients can go to work the next day. We do recommend to the patient not to lift anything heavy. So I usually ask the patient what type of profession they have. If they have certain professions require heavy lifting, so if they want, I can give them a doctor's note that they are excused from lifting heavy items. If they want to go to work, if they really have to go to work, I give them a doctor's note that they don't need, that they should not lift anything heavy, and that should be good enough. With some medicine, it's going to be fine. I usually do give antibiotics after an extraction in order to avoid any infection, and of course painkillers so that they be as comfortable as possible, and usually that helps a whole lot.
I see. Dr. Bral, thank you so much for doing this interview and giving our viewers the information on the complications and remedies for tooth extractions.
Oh, sure. Thank you very much. Thank you for interviewing me.
My name is Michael Grady. This has been another episode of Local Expert Interviews. If anyone needs to have a tooth extracted or would like more information from Dr. Bral, please refer to the phone number at the bottom of the screen. Thank you again, Dr. Bral.
Thank you. Take care.
Hi, my name is Kishara De Sosa Murray. I had a dental emergency, was walking by and just happened to find Dr. Bral. He's amazing, super accommodating. The extraction was virtually painless. I didn't even feel any pressure, which is rare, and I'm very happy that I found him, and I will be coming back.
My name is Lydia Davis. I'm recommending you to this Dr. Pride. What a beautiful dentist. I was here 3 different times, and he pulled 6 of my teeth. Never have no problem. Not even pain in my mouth after. I'm telling you, this is the best dentist I ever knew that anybody can go to. He is a good dentist. And I'm recognize y'all that come here to this dentist. So far. And he deal with you and work with you. When you don't have a whole lot of money, he works with you. So I'm recommending y'all to come here to this dentist. No pain in my mouth. I done had pulling 6 teeth, no pain. No problem eating after. I'm asking y'all to come to this dentist because he's the best. Thank you.
My name is Brenda Aragon. I came to know this clinic and Dr. Bral. Upon looking on the directory, I came for the extraction of my tooth, and the extraction was done perfectly. There was no cut down. It was just pulled out the tooth, and I find the doctor very kind, accommodating, and I think he's a good doctor anyone can find. He's I think I'm going to recommend him to my friends and to my family. That's it.
My name is Leanna, and this is my first time getting a tooth pulled ever. And I recommend Dr. Bral because I didn't feel a thing. Everything was numb. I thought I was going to be crying and in tears and bleeding all over, and I wasn't. He did it 1, 2, 3. The needle didn't hurt. The pulling didn't hurt. The numbing is great.